in the context of say, India, for example. I know that there have been some, but I wouldn't be surprised.
I was actually coming to that question. Before that, I want to ask, before jumping to that topic, I want to ask...
Preventive interventions are very cost effective. So there's an old adage here in the U.S. An ounce of prevention is worth a pound of cure. So by waiting until something like substance use or mental health challenges become a problem, you're not going to be able to save as many lives, and you're also going to cost your community a lot more money.
Hello and welcome. Today I'm speaking with Professor Nathaniel Riggs, Executive Director of the Prevention Research Center at Colorado State University. He's an expert in helping communities turn research into real prevention that work. Let's get started. Dr. Nate, thank you so much for joining us today.
Yeah, of course. Yeah, and again, feel free to call me Nate. Yeah.
Nate, in simple words, let's start with prevention science. Tell me, why does it matter? What's prevention science and why does it matter?
Yeah, okay. So prevention science is a relatively new scientific field. So maybe the last, maybe 40, 50 years. And what we've done is we've done a pretty good job of leveraging other insights from other scientific fields like public health, neuroscience, developmental science, psychology, sociology, and we have identified ways that we can address the precursors of future mental health and behavioral health problems. So what we've been able to do over the past 40, 50 years is really identify what we call risk factors. So things that predict the onset of a negative health outcome like substance misuse or depression or something like that. As well as protective factors, these things that can protect people from the effective risk factors. And then we've done a pretty good job of developing what we call evidence-based prevention programs that can address these risk and protective factors.
And I think it's a great job. I think we could simply say you are bridging the gap between the theory and the practical side of implementing it. I think we don't have this kind of implementation in any other research field. Do we have any? I mean, most of the research that we do on, on almost other sectors, I never came across anything that, kind of implement and bridge this gap. Especially you're working inside the university. Is that correct?
There's similar stories here in the U.S. I mean, we're really starting to think about this, and we spent the first couple of decades in prevention science just trying to figure out, can we actually move the dial on these public health outcomes? Can we actually affect them before they become an issue? And so, we spent a couple of decades doing that in tightly controlled randomized trials, and then now over the past 20 years or so, we've been realizing, okay, we really need to support communities when it comes to implementing these programs, because a lot of times the people who are implementing preventive interventions, at least in the U.S., they are really committed, they're really smart, but they might, in most cases, haven't been formally trained in how to implement preventive interventions. And so that's what we're here for at my center, is to really support those folks. One of the things that I'm really proud about at Colorado State University is that we really adhere to what we call community-based participatory approaches to research and practice. So we're not the universities coming in and telling communities this is what you need to do, right? What we do is we recommend that communities collect data or use their own data, and also check in with their communities so that the communities can have a voice in what they really feel is going to be feasible and acceptable by community members. And then really working alongside those community partners so that they can identify and select those programs that are going to work best in their communities. We talk about implementation fidelity. where we say, hey, this is how the program's intended to be delivered, and then that's a big challenge when it comes to a lot of the work, a lot of the research that's been generated here in the United States, and then trying to adapt that to other contexts in other countries where an approach may not be feasible, acceptable. What we've done in Colorado is we've leveraged different funding sources to support communities in implementing, for example, a program called the Blues Program that really focuses on promoting emotional awareness and cognitive restructuring for young people who have already been demonstrating some challenges with anxiety and depression.